And New York Democratic Congressman Anthony Weiner pushed the idea of expanded Medicare over the summer, and he joins me now. And a good morning to you.
Good morning, Alex.
So is this compromise, is it just as good as the public option?
Well, I think in many ways that it's better. You know, we have this arbitrary number of 65 years old to get into Medicare. If you stop a 60-year-old guy on the street and say, listen, I'm going to give you Medicare starting this year, you'll see how thrilled they'd be. Because for people in that age, it's very difficult to find affordable health care. A disproportionate number of people that get laid off are in that area. So this is, I think, frankly, preferable to a public option. If we can expand Medicare to cover more Americans, it really is going in a direction that I think saves us a lot of money and builds on a program we all know and trust.
Now, I'm curious, is it better from a financial perspective, or is it better from a delivery of quality health care perspective, or both?
Both. I mean, look, let's face it, private insurance companies, when we're providing subsidies for people to buy insurance, we have to put an extra 25 to 30% in for the profits and overheads of the insurance companies. With Medicare, they have a 1% overhead, so it's a much more efficient program. And also the care is good. I mean, the fact is that the reason you have terms like pre-existing condition is that private insurance companies have been trying to drive those of that more senior age off their rolls to save money. Medicare specializes in those Americans, and I think it's going to wind up being a real benefit to a lot of people.
So if the compromise can replace the public option, why was that such the focus in the first place?
Well, it's interesting. I mean, frankly, for many of us, and I've come on with you before and said that the public option for me represented a compromise. I think that we should have expanded programs like Medicare right from the very beginning. The public option was seen as a way to get some competition. Well, in fact, Medicare also provides competition for the private insurance companies. I think what wound up happening is a lot of, or not a lot, but a few members of the Senate said, we don't want to create any new program. That's a reasonable position to have so long as you have a substitute. And in this case, there is a ready substitute in two programs that the federal government has that works. One is Medicare, and the other is the Federal Employees Health Benefit Program that serves 9 million federal employees and their families.
And you want single-payer plan. Does this help put us a step in that direction?
Well, frankly, Medicare, you know, for all the talk about single payer, about half of all of our health care dollars in this country go to a single payer system now. Medicare, Medicaid, the VA, the Department of Defense, all single payer means is that the money goes directly from people to their doctors and doesn't go to insurance companies on the way so they can take 20 to 30 or 40% off the top. So yes, what this is, call it what you will, Medicare for more Americans. I think ultimately we should probably have a program like Medicare with low overhead for all Americans, but this is a step in the right direction.
Okay, Representative Anthony Weiner, good to talk to you. Thanks so much.
Thank you.